Hi everyone, Brett here and welcome to another one of our MStranslate research summary videos. So today I'm going to be talking a little bit about the phase 3 clinical trial results that came out a little while ago that indicated that there might be a new treatment for secondary progressive MS. Obviously lots of excitement about this considering there's no real treatments at the moment that have been shown to be beneficial for people with SPMS. Now, these results did come out a little while ago, and we've been a bit delayed in terms of talking about it. The reason for that, we wanted to really thoroughly analyse the publication itself and the actual data before we talk to you about it, just to make sure that what we talk about is 100% accurate and you're getting the best information possible. So this new treatment that underwent this phase 3 clinical trial is called Siponimod. And works in a few different ways, or is hypothesized to work in a few different ways anyway. The way that it is known to work is essentially that it prevents immune cell movement, as you can see in that image there on the left. And so really the theory behind this is if we know that the immune cells, or cells of the immune system, are the ones causing the damage in MS, so they're the bad guys, in inverted commas. Well, what do we do with bad guys when we know that they commit a crime? Well, we lock them up so that they can't go out and keep committing those crimes. So in the same way, we sort of lock the immune cells into these compartments in the body so that they can't access the central nervous system and keep causing damage. There's also been some indications, not in clinical models, but in sort of cell work within labs that suggests Siponimod may have some benefits in terms of preventing neurodegeneration and maybe promoting myelin repair, though both of those aren't really clear yet and haven't been proven. So what did the results of this phase 3 clinical trial show? So there were these three key things. Firstly, and the one that's been talked about quite a bit, is that they showed that there was a statistically significant slowing of progression, disease progression in people on Siponimod versus placebo. Now, this difference was moderate, and I think we need to be careful about going too overboard in terms of how we talk about this result. Yes, statistically it seemed to be different, but was that going to have any sort of clinical relevance? Well, another result that they looked at showed that there was no difference in the timed walking test. So the timed walking test is often a really good functional output of what's going on in the body. So while there seemed to be this delayed progression, a very small delayed progression in the people on Siponimod, that didn't translate into any sort of functional benefits in terms of that timed walking test. What they did see, though, was that there was some differences on MRI outputs from the people taking Siponimod versus those on placebo in terms of things like decreased lesion volume and maybe a slight suggestion of a slowing of brain volume loss, which can both be important. But what we need to sort of think about here is whether or not this treatment is working in a way that's going to be specifically beneficial for people with secondary progressive MS, or whether it's just having a bit of an anti-inflammatory effect, which is what we see with most of the relapsing remitting drugs. So while there were some positive results here and some interesting results, it's likely that these really need to be analysed further, maybe with some more clinical trials, to really understand what's going on and to get conclusive sort of evidence in terms of the benefits of Siponimod for people with secondary progressive MS. In terms of the safety of the side effects, this is obviously something that's hugely important when we talk about these clinical trials. There definitely was adverse effects, there was side effects, as is always the case with these different medications. The ones that they saw were similar to those for other treatments that work by the same mechanism, and so Siponimod is actually very similar to fingolimod, or Gilenya as it's known, and so the side effects seen were similar to the ones that have been seen for that medication. Importantly, the overall frequency of death, malignancies and infection weren't at all different between the two groups, between those on Siponimod and those on placebo. So that's sort of a summary of the results from that phase 3 clinical trial. Obviously, it's a very broad overview at the moment, but as always, if you do have any questions or want more information, all you have to do is comment below the video. And as always, we want to make sure that as many people get access to this information as possible, so you can help us do that by making sure that you like, comment, and share the video so that we can really increase the reach of the people who see this content. All right, thanks guys, can't wait to talk to you again soon.